Almost every family is touched by type 2 diabetes in some way, and its long term consequences can be devastating. It slowly damages multiple organs over time. For me, this topic is personal. My mother lived with type 2 diabetes, and it severely impaired her kidney function. Most of us grow up hearing oversimplified advice about diabetes. Avoid sugar and avoid foods that spike blood glucose. While sugary processed foods are indeed harmful, this message often leads people to avoid certain whole foods like fruits or starchy vegetables that are actually beneficial. But blood sugar is not the root cause of diabetes. The underlying cause of high blood sugar is insulin resistance. Let's hear from Dr. Neal Barnard.
Let me show you what causes type 2 diabetes. This is very, very important. If you're watching this with just half an eye, let me have your full attention for just the next couple of minutes. This big blue oval, that's a cell, one of the cells in your body. And your cells are powered by sugar, glucose. Glucose is a natural sugar that goes through those funny little purple channels into the cell, and the glucose gives them fuel, it gives them energy. But your muscle cells, your liver cells, they can't get the glucose into the cell at all without a key, and the key is called insulin. Insulin is made in your pancreas. It's a hormone. It goes into your bloodstream, it arrives at the cell, and it acts just like a key. It opens up the cell to let the glucose inside. Specifically, when the insulin arrives you see those red receptors there? Once the key arrives into the receptor, just like a key in a lock, it's now opening up those purple channels, and there's the glucose coming right inside. If you've got type 2 diabetes, you've got glucose trying to get into the cell, you've got insulin trying to let it in. What's gone wrong? The problem is inside the cell. You see those yellow blobs? That's beef fat, chicken fat, pork fat, corn oil, olive oil. That's unhealthy grease that's packing up the cell, and now the insulin key can't work because the cell is gummed up with fat.
For decades, we didn't fully understand what causes insulin resistance. It wasn't until the early 2000s that the research became clear. Fat inside our cells, especially saturated fat, is a major driver of insulin resistance.
This mechanism by which fat, specifically saturated fat, induces insulin resistance wasn't known until fancy MRI techniques were developed to see what was happening inside people's muscles as fat was infused into their bloodstream. That's how they found out that elevation of fat levels in the blood causes insulin resistance by inhibition of glucose transport into the muscles. And this can happen within just 3 hours. One hit of fat can start causing insulin resistance, inhibiting glucose uptake after just 160 minutes. On a high-fat diet, the ketogenic diet, insulin doesn't work as well. Our bodies are insulin resistant. But as the amount of fat in our diet gets lower and lower, insulin works better and better. This is a clear demonstration that the sugar tolerance of even healthy individuals can be impaired by administering a low-carb, high-fat diet. But we can decrease insulin resistance, the cause of prediabetes, the cause of type 2 diabetes, by decreasing saturated fat intake.
Keeping total fat intake low, especially saturated fat, is crucial. Saturated fat is so harmful that it doesn't just cause insulin resistance, it can also impair insulin secretion by damaging the beta cells in our pancreas.
Autopsy studies show that by the time type 2 diabetes is diagnosed, we may have already killed off half of our beta cells. You can do it right in a petri dish. Expose human beta cells to fat, they suck it up, and then start dying off. A chronic increase in blood fat levels is harmful, as shown by the important effects in pancreatic beta cell lipotoxicity. Fat breakdown products can interfere with the function of these cells and ultimately lead to their death. And not just any fat, saturated fat. The predominant fat in olives, nuts, and avocados gives you a tiny bump in death protein 5, but saturated fat really ramps up this contributor to beta cell death. Saturated fats are harmful to beta cells, harmful to the insulin producing cells in our pancreas. Cholesterol, too. The uptake of bad cholesterol, LDL, can cause beta cell death as a result of free radical formation. So, diets rich in saturated fats not only cause obesity and insulin resistance, but the increased levels of circulating free fats in the blood, called NEFAs, non-esterified fatty acids, causes beta cell death and may thus contribute to progressive beta cell loss in type 2 diabetes.
So, what's the recommended diet?
So, what's our prescription? No animal products, minimize the oils, favor the low GI foods.
Notice that Dr. Barnard emphasizes eliminating animal products. One major reason for that is most animal foods are naturally high in saturated fat. But what if you focus on low fat animal protein, like skim milk?
Based on over a dozen randomized control trials, even just swapping like a third of protein from animal to plant sources can significantly improve blood sugar control. What's the difference between animal protein and plant protein? We think it's the branched chain amino acids concentrated in animal protein. It turns out a branched chain amino acid breakdown product appears to stimulate fat uptake and accumulation inside the muscle cells.
So, quick recap. Animal products contain saturated fat and cholesterol, which promote insulin resistance and damage pancreatic beta cells. Animal protein contain branched chain amino acids, which drive fat buildup inside our cells, worsening insulin resistance. If you decide to follow the dietary approach recommended by Dr. Barnard and Dr. Greger, and you are currently taking medications, it's extremely important to work with your doctor. This diet is so powerful that when combined with medication, it can drive your blood sugar too low, which can be dangerous.